presenter that will be sharing with us today represents as the owner of the Work-Life Urgent Care and Behavioral Health, LLC. And so we're going to invite her up, and I just love being respectful of people and their names and such. So if I can't pronounce your name, I don't butcher it. I just let you introduce yourself because you know your name better than anybody else. And if you don't, there are some mental health people in here who can assist you with that. But we'll have that presentation this morning about sexually transmitted infections and depression. So let's receive her today.
Are you sure you didn't want to try to pronounce that name? No? Okay. Good morning, all. For those of you who do not know me, my name is Latoya Nkongolo. That's what you would have said. See? You should have tried it. And I'm a licensed clinical social worker and licensed clinical drug and alcohol counselor. And I am the co-owner of Anne Arundel County's first integrated behavioral health, now urgent care and primary care practice located in Glen Burnie, Maryland. The reason why this all came about is because, one, my husband and I have tons of student loan debt. He's a physician's assistant. I'm a social worker. So we wanted to do something to really use the skills and, use our professions to honestly help the community in a way and make an impact in a way that we know how, that we've been trained to do. We opened about a year and a half ago, and I was sharing with Marcella that what I have seen in our practice has been unbelievable. The young adults who are coming in who are being newly diagnosed with sexually transmitted infections is beyond words. I can't even describe to you the young adults who are being devastated by being diagnosed and what that means for their future. So for me as a clinician, I'm finding myself doing more therapy with people around depression because they are having a hard time struggling with coping and moving forward in their life because of their diagnoses. So as we're waiting for the presentation to come up on the screen, basically what we're going to talk about today, and I only have 15 minutes, is really just to share with you a brief overview of sexually transmitted infections and depression and how they correlate. Also, the symptoms of depression in newly diagnosed individuals, and kind of my personal experience as a clinician and what I see in the necessary treatments and what resources that I have found that have been helpful for working with people who have been diagnosed with sexually transmitted infections. Just giving our tech team a couple of minutes here. Sad, empty, or hopeless, or observed, are those feelings observed by others. So how many of you know someone that they don't know that they're acting differently, or they may not realize that they're sad or hopeless, but you probably see it. We all know those people, those family members that we look at and say, well, something's wrong with you. You seem off. You need to talk to someone. So if it's not observed by you, keep in mind that other people are seeing it and take heed to what other people are seeing. Markedly diminished interest and pleasure in all or almost activities, nearly most of the day or all day. Changes of more than 5% of your body weight. So that can be an increase or decrease of 5% or more in 1 month in body weight. Insomnia or hypersomnia. So that means either sleeping too much or sleeping too little. That can be an unusual sleep pattern for you. Feeling restless or being slowed down. Fatigue and loss of energy. How many of those people do you know that you see that they just want to sit home and chill and relax? You know, if you do that a little too much, then that can be a sign of depression. Feelings of worthlessness or inappropriate guilt. Diminished ability to think or concentrate. So just having those racing thoughts, not being able to focus on one thing, just not being able to gather your thoughts can be a sign of depression. And recurring thoughts of death or thoughts of suicide or even attempts at suicide. So with those symptoms, signs of depression, in combination with being newly diagnosed with a sexually transmitted infection, should be the next slide, being diagnosed with a sexually transmitted infection can bring or exacerbate underlying mental health issues. So let's say you have someone, and we always say, what came first, the chicken or the egg? You have someone who may have had some depression there, but it was kind of brought to the surface as a result of being diagnosed. So it kind of triggered it to worsen. with the diagnosis. And it compromises the success of risk reduction counseling. So in the beginning, a lot of people don't want to hear how they can get help. They don't want to hear medication. You know, they don't want to hear that it's okay. A lot of times you just got to allow people to process it, and they have to talk to a professional to be able to later accept that they have this diagnosis and they can move forward and live a healthy life. It can cause a person to avoid intimate relationships. You know, I talk to young women all the time, and they're like, you know, I don't feel attractive. I don't know why someone would be attracted to me. I feel dirty. And they don't want to pursue close relationships because they don't feel that they're worthy. And also it can cause hypersexual activity. I've had clients that have said, you know what, I don't care anymore. You know, I'm just going to live. I only live once. I might as well just go ahead and just live it up. And that again can cause an increase in the risk to our community, not just themselves. So some of the therapeutic approaches is that, for one, I try to reduce the stigma with the young adults that I work with. I let them know that, you know, this is something that, you know, as far as herpes, for example, because I see a lot of that, is that 1 in 4 adults are diagnosed with herpes. So you're talking 25% of the population. So I try to reduce the stigma around that to educate them on the numbers, on that they're not alone, and that you're not a dirty person. We're seeing people from all walks of life. We're seeing professionals. Just recently, I had 2 people that I just met with just in the last week. You know, a young 24-year-old adult woman. She's a professional. She's college degreed, went to a very good school. And, you know, for her issue was that, you know, she's not married. She hasn't had any children yet. She feels like if she has, you know, herpes, she's going to, you know, pass this on to her child, and her child is going to come out with some sort of disability. So, you know, me being a professional, now that I'm doing this, I'm like, you know, having to gain more information on it, and I have to help her understand that, you know, it does not mean that your baby is going to come out with some sort of disability. It does not mean that you can't give birth to healthy children, get married, and move on with your life. Another young lady I met with recently, she had just gotten divorced. She just re-entered to, you know, the dating scene. You know, she met someone that she thought she trusted, and you know, ended up having a sexual relationship with him. And shortly after she was diagnosed, she believes that it came from this person. But the relationship ended, so now she's dealing with the feelings of, you know, I'm rejected, you know, nobody's going to want me. So these are the common things that, as a professional, that I have to provide the support and help people process those feelings and work towards accepting that, you know, this is something that that you can recover from emotionally, and you can have a healthy future. Also, I'm finding that I'm using the stages of grief more often with these young adults. So, you know, you have someone who's, you know, when we think about grief, we think about death. We think of the loss of a loved one. But grief can apply to any significant loss. It can apply to, you know, a loss of a job, a loss of a relationship, anything that's significant to you that's going to cause some emotional distress can be grief. So denial, that is a common symptom that I see often with these young adults, is that a lot of times they're in denial. They say, oh, well, the doctor, this was a false positive. I need a second opinion. You know, I don't really think that this test is accurate. So there's a lot of denial there. And then they move to the anger stage. Now they're angry at the doctor. You know, why didn't I get tested for herpes 10 years ago? I didn't realize that you don't randomly test for it. I had to get a blood test. So now they're angry at the doctor. Maybe I had this years ago. How many people did I infect? And then angry at the partner, the person that may have potentially infected them. I had a lady that just went through, she's in the bargaining stages of grief. She was just, you know, praying to God, if you just take this away, I promise I'll be good, or I'll be safe next time. So just kind of bargaining, if I can get rid of this feeling, you know, some kind of way, you know, please, let's just negotiate this. And then obviously the depression, the sadness, and the hopelessness that comes along with it. And then, you know, ultimately you want to move towards acceptance. And the acceptance stage is where a person feels more hopeful, where they feel like that, you know, life is going to be okay. You know, I can be a healthy, functioning adult, despite my diagnosis, and especially this applies to, to herpes and HIV. Chlamydia and gonorrhea, we do see a lot of devastation there, but it mostly applies to those infections that, require long-term treatment. So ultimately with this, it's really just about helping you all understand that it is real. This is in our community, and we all need to take heed to this. If you know a young adult who is sexually active, let them know that this is real, that 1 in 4 adults are being diagnosed with herpes, that, there's a rapid rate of chlamydia and gonorrhea in our community, and they're at high risk. Don't just assume that the person that you're sleeping with, that you're the only person that they're sleeping with, and that there is help out there. And if a person is diagnosed with a sexually transmitted infection, they may require the psychotherapy. They may require, some support with a licensed clinician in order to cope with those feelings that come along with it, because those feelings are real. And the bottom line is that treatment is available, medical treatment, obviously, therapy treatment, and that emotional recovery is possible. All right, any questions? None? You guys are quiet. Yes, sir.
I'm at a principal, a high school.
Mm-hmm.
Can this be used as far as for those teenagers, or do they have to be 18 and over?
No, they don't have to be 18 and over. The statistics apply to adults, but absolutely, kids are at risk. Kids are sexually active.
So as far as the services, your resources, and are we able to use that as a pipeline from our school to, because we're right in the community?
Definitely. Yeah, the youngest client I have is 4 years old. So I'm seeing people from 4 to, I think my oldest is 72. Yep. And, and a variety of issues. And, not only are we seeing this, this mostly pertains to the, the young adults, but we're seeing teenagers that are contracting sexually transmitted infections, older adults even. It doesn't discriminate. We're seeing people from all walks of life, all demographics being diagnosed. Medical assistance, Medicare, Blue Cross Blue Shield, Cigna, just about every private insurance. Yeah. Yeah. All right, yes. I am definitely open to it, and I have some information on one of the tables there. So my business card and the clinic brochure is there, and we're open 7 days a week. We take walk-ins and appointments, so you all are more than welcome to stop in and say hi. Yes, yes. Yes, so we have a psychiatrist, we have 4 therapists, 5 including myself. We also have a medical assistant, we have an x-ray lab. So it's an integrated clinic, so people can come in for a broken bone, but if they fell down drunk because of their broken bone, then they have a therapist on staff to talk to about their alcoholism or addiction. Or diabetes and depression, there's a correlation there. So, we're seeing a lot of people that come in for a mental health issue, but they have a medical issue, or vice versa. So it's kind of like a one-stop shop.
So do you do STD testing?
Yes, we do. We do drug testing, pregnancy testing.
So do you know about reporting the disease to the health department?
I do now that I know you and I've met you. Mm-hmm.
And we're the people on the other side that see the reports, and I don't necessarily remember seeing your facility.
I'll have to talk to my husband about that. He does that medical side of it, but yeah. That's right. Okay. All right. Anyone else? All right. Well, I will be here if you have any questions, and thank you so much for your time.